I have proper PPE and my scene is safe. According to dispatch, our mechanism of injury today is a motor vehicle accident. This is my only patient. I will be requesting ALS, and because of our mechanism of injury, I'm going to have my partner hold C-spine to prevent any further spinal injuries. So now I'm going to be checking for my patient's level of consciousness. Hello, sir. My name is Karla Covarrubias. Today I'll be your EMT assisting you today. He did not respond to my voice, so now I'm going to be inflicting pain. Sir, are you okay? He did not respond to painful stimuli, so our patient is unconscious. I'm going to be looking. My general impression, we don't see any major bleeding, and he is a 17-year-old male laying supine on the floor with his eyes closed. So now we're going to be assessing our ABCs, A being airway. So I'm going to be opening his airway and looking inside for any vomit, anything that could be obstructing his airway. His airway seems to be patent, so we do not need to insert an OPA. So now we're going to be assessing his breathing. I hear breath sounds. I see an equal rise and fall of the chest. I'm going to be listening to lung sounds. We do have clear lung sounds. And now I'm going to be putting my patient on a non-rebreather mask at 15 liters per minute on oxygen while I check his circulation. So we're going to be looking for a pulse. We have a weak radial pulse of 130 beats per minute. I do not see any major bleeding. There is no major bleeding that I could see. His skin is cool, pale, and diaphoretic. So I'm going to be treating my patient for shock. And my patient is a priority patient. We will need to transport him immediately. His Glasgow coma scale would be at a 3 since he is unconscious. And because if he was conscious, right now I'd be asking him sample. But since he is not conscious, he cannot answer my questions. And now I'm going to be getting a full set of vital signs, starting with blood pressure. Okay. We got a blood pressure. His blood pressure was 110/94. Now we're going to be getting a pulse rate and a respiration rate. Once again, his pulse rate is 108 beats per minute, and his respiration rate went down to 26 breaths per minute. So now we're going to be doing a full body assessment, starting with the head. I'm going to be palpating the head, looking for any broken bones, any crevices. And also I'm going to be checking the face, the nose, see if anything's broken. We're going to be looking at his pupils. His pupils are reactive. Now we're going to be moving to the ears, looking for any blood, any cerebral spinal fluid, which we do not find. Now moving down to the neck, looking for any JVD, any tracheal deviation, and I'm also going to be palpating the cerebral spine, which everything seems to be normal here. So now we're going to move down to the chest. Palpating the chest, looking for any movement, any fractured ribs, which our chest is normal. I'm also going to be listening to the lung sounds once again. Again, we do have normal lung sounds. Now we're going to be moving to our abdomen, palpating each quadrant. Our abdomen is soft, non-tender. Now we're going to be moving to our pelvis, making sure it's intact. and stable, which it is. So now we're going to be moving to our lower extremities. On his right leg with both hands, going to be going down. No deformities on his right leg. Now on his left leg, we do have a deformity on his lower left leg. Now we're going to be checking for pedal pulses. We have pulse on both legs. If my patient was conscious, I would be asking him PMS right now. But since he is not conscious, we know we have a pedal pulse. So now the same thing in the upper extremities. No deformities on any upper extremity. Checking for pulse on both hands. We have a pulse. Again, we would ask for PMS here if our patient was conscious. So now we're going to be putting our patient on a longboard, and on my partner's count, we're going to be log rolling the patient towards me and putting him along longboard. But before we do, I'm going to be checking his thoracic, his lumbar, and his buttocks to make sure everything is intact there. So on your count, we're going to be log rolling the patient towards me.
1, 2, 3.
Okay, now I'm going to be checking the thoracic, the lumbar, and the buttocks. Everything seems to be normal. And then on your count, we're going to move them back.
1, 2, 3.
Okay. Now I'm going to be managing any secondary injuries, which I'm going to be splinting his left leg deformity. And I'm going to keep treating him for shock. I'm going to keep him on oxygen. And we're going to be reassessing our patient every 5 minutes since he is a high priority patient. And I'm going to be looking for pedal pulses on both legs and until ALS arrives.